muscle rhabdomyoma. What is it? A rare benign tumor made of skeletal muscle cells. Who gets it? Mostly found in adults, sometimes in children if it's the fetal type. Where does it grow? Commonly in the head and neck, especially the tongue, larynx, and pharynx. What does it look like? Grows slowly, does not spread, and can be removed with surgery. Symptoms may cause difficulty speaking or swallowing if it's large. 2. Rhabdomyosarcoma. What is it? A malignant tumor of skeletal muscle cells. Who gets it? Mostly in children and teenagers. Where does it grow? Common in the head and neck, genitourinary tract, and extremity. Embryonal, most common in kids under 10 years, often in head, neck, or genitals. Alveolar, teens and young adults, more aggressive, often in arms, legs. Pleomorphic, adults rare. Symptoms: mass or swelling, pain, can grow fast, can spread to lungs, bones. USMLE style questions. Question 1. A 6-year-old boy is brought to the clinic because of a painless mass in his right orbit. The mass has grown rapidly over the past month. Imaging reveals a soft tissue mass behind the eye. Biopsy shows small round blue cells with areas of muscle differentiation. Which of the following is the most likely diagnosis? A. Retinoblastoma, B. Neuroblastoma, C. Embryonal rhabdomyosarcoma, D. Striated muscle rhabdomyoma, E. Pleomorphic adenoma. Correct answer: C. Embryonal rhabdomyosarcoma. Explanation: C. Embryonal rhabdomyosarcoma is the most common soft tissue sarcoma in children. It often appears in the head and neck, including the orbit. Rapid growth, young age, and histology showing muscle cells, rhabdo, and small round blue cells match this diagnosis. Why not the others? A. Retinoblastoma usually affects the retina and presents with leukocoria, white reflex, not an orbital mass. B. Neuroblastoma can cause orbital metastasis, but primary tumor is usually in the abdomen, adrenal gland. Histology is different. D. Striated muscle rhabdomyoma, a benign tumor, rare in children and grows slowly, not likely with a rapidly growing orbital mass. E. Pleomorphic adenoma, benign salivary gland tumor, not common in the orbit or in children. Question 2. A 45-year-old man presents with a slow-growing mass in his tongue that causes some difficulty speaking. Biopsy shows mature skeletal muscle fibers without atypia or mitoses. What is the most likely diagnosis? A. Squamous cell carcinoma, B. Rhabdomyosarcoma, C. Striated muscle rhabdomyoma, D. Mucoepidermoid carcinoma, E. Liposarcoma. C. Striated muscle rhabdomyoma. Explanation: a benign skeletal muscle tumor in the tongue of an adult with a slow growth and no cellular atypia strongly suggests striated muscle rhabdomyoma. Why not the others? A. Squamous cell carcinoma, malignant, common in oral cavity, but would show atypia and mitoses. B. Rhabdomyosarcoma, malignant, more common in children, and grows fast. D. Mucoepidermoid carcinoma, salivary gland tumor, not a muscle tumor, would have glandular mucus components. E. Liposarcoma, malignant tumor of fat cells, not skeletal muscle, also more common in deep soft tissue of limbs, retroperitoneum. Let